Kenya's health sector is set for restructuring after President William Ruto signed the Social Health Insurance Act into law. The Social Health Insurance Act repeals the current National Health Insurance Fund and establishes 3 new funds: the Primary Health Care Fund, the Social Health Insurance Fund, and the Emergency, Chronic and Critical Illness Fund.
In terms of the limit, so what the fund envisions is there'll be the primary healthcare where all Kenyans will have access, whether you have paid or they've not paid, whether you're an indigent or what. The government through the exchequer will be able to pay for the primary healthcare services. That is what you access when you get a cold. You can be able to access. So it will not matter whether you paid or not, and that is paid from the exchequer. Then now you'll have the social health insurance where the government will set, or the SHA as it is, will actually set a benefits package. So we'll say similarly to what you have in an insurance company, where you have a benefits package for this particular group of people. And this will be now for everyone, that you have access either to dialysis, you have access to treatment for cancer, etc. So we'll set what we define as a Kenyan benefit package for the whole country, and that is what now you'll have access to. So should something not be within the benefits package, that one is what now you might have either to pay out of pocket, or basically can be covered under the chronic illness or the emergency.
The law is expected to help the government provide affordable, universal healthcare to Kenyans.
The social health insurance bill is a bill brought about to change how health is financed in this country. Currently, majority of health financing in this country is out of pocket, where you actually pay for your services. We have about 20% of Kenyans who are insured, however, a significant proportion of which don't actually pay their annual or their monthly fees. Yeah? So we have a very small percentage of Kenyans who essentially pay out of pocket, which now results into a population which is not entirely covered. So you're having people either not seeking services because of financial hardship, you're having people who are being impoverished because of medical bills. I'm sure a majority of us have contributed either to somebody's getting hospital care, or even a funeral because they were not able to afford care. So essentially the bill brings about changes within the healthcare financing by having a social health authority, which is now the organization which is going to move NHIF into an SHA. The current act, as signed by the president, currently now gives the authority to the cabinet secretary to come up with regulation in consultation with stakeholders, that is you and I, to come up with figures which will be equitable to everyone and also affordable. Remember, previously NHIF was a flat rate for the person who was contributing out of pocket. Everyone was paying 500 per month. Whether you're earning $1 million or you're earning 5,000 bob a month, you were paying the same. And then for the salaried, you had, yes, a percentage of income up to a maximum of 1,700, which is still not very equitable. So this bill essentially envisions equitability in terms of contribution of funds. The figures have not been defined yet. They will be defined, but it is envisioned that there'll be categories of contribution. So you'll have the salaried workers who will contribute a percentage of their salary. Then you'll have the non-salaried who will also contribute a percentage of their annual income. So it will be an annual contribution as opposed to the monthly contribution. And this will be what you call self-declaration at first, in terms of what is your annual income, then you self-declare, and then eventually there'll be a matrix which will be used to actually calculate your annual income based on maybe your access to services either through the Kenya Revenue Authority or other government services. They can be able to estimate your annual income. And then you'll have a third category of people who can't afford, so won't pay, can't pay. Those are the ones who will be paid for by government. So you'll have those 3 categories. So as it is right now, no specific figures, but most likely you'd have like a figure like 300 for a minimum figure of 300, and also possibly a maximum figure. Every Kenyan would be covered, and also in terms of increasing the pool of the contributors by having everybody on board, every Kenyan on board, so increase the contributors, and also having the taxpayer, also the tax or the exchequer put in some money, does not mean that you you will be able to pay more because of others who are not paying. So it should be part of the social protection by the government. So in terms of how the contributions will be calculated based on ability to pay, which is a percentage of your income.
While the regulations on how much money Kenyans will be expected to contribute are yet to be determined, the hope is that this bill will achieve the desired universal health coverage for all Kenyans.